All right, looks like we are live, everybody. Thanks for joining. This is the Special Committee on Long-Term Healthcare, Monday, July 17th at 3:05. We're going to get started. Madam Clerk, can you call the roll?
Alderwoman Boyd. Alderwoman Sanier.
Present.
Christine Ingracia.
Present.
Danielle Spradley. Jamie Opsel.
Present.
Marjorie Moore.
Present.
Harold Braswell.
Present.
Chris Bakley.
Present.
Cassandra Kaufman.
Present.
Lavita Richardson. Cindy Jackson. Kevin Anthony.
Present.
Andrew Lackey.
Present.
Laura Barrett.
She mentioned that she's having problems logging in.
Okay. Kathleen Holmes. Annalise Stover. Chair Aldrich.
Present.
Danielle Spradley. Lavita Richardson. Cindy Jackson. Laura Barrett. Kathleen Holmes. We have 10 present. We have a quorum.
Thank you, Madam Clerk. And Mr. Harold, if I also text Laura, if there's any way that myself or we can on this side of the end try to get her in, please let me know and jump in. I think she's going to try to get in by phone. But thank you guys for all joining this long-term healthcare committee. My Alderman Rasheen Aldridge, I'm really excited to.
I'm sorry, Mr. Aldrich. We do have minutes to approve.
Yes. Oh, yeah. Well, let's do the approval of the minutes first, and then we're going to the committee discussion. So you guys, last meeting was Monday, April 10th, when you guys had the last special long-term healthcare committee, and we have to approve those minutes. All those minutes should be in the drive if anybody want to check them out. And with that, I would just take a motion to approve the minutes Monday, April 10th, 2023.
So moved.
Second.
All in favor, aye.
Aye.
Opposed? And just for clarity, did I need a roll call on that, Madam Chair?
If everyone isn't here, yeah, we do need, or someone can call for previous roll.
All right, so I'll remake the motion. Sorry about that. Motion to approve the minutes Monday, April 10th, 2023.
Second.
So we had a first from Sanier and a second from Ingracia.
Mm-hmm.
Do we have a previous roll?
Previous row.
No objections?
Seeing no objections, minutes approved. Thank you, Madam Chair. Okay, again, everybody, I'm Alderman Rasheen Aldridge. I am really excited to be the new chairman of the Long-Term Healthcare Committee that Madam Green, our president, set up. Thank you to previous Alderwoman Christine Ingracia, who will be staffing from the president office on this meeting, helping us out. Also want to give a huge shout out to Alderwoman Pam Boyd, Alderwoman Middlebrook, and all of you all who have put a lot of work into getting the long-term healthcare committee to this point. The goal was last year to have several meetings here from speakers, people that are specialists in our long-term healthcare facility, and then to come up with recommendations. Since we didn't get the recommendations fully completed, the president take this committee very seriously and want to make sure that we continue the work that's necessary, gathering data, making sure we hear from speakers. I know there's several speakers that were scheduled to speak last year or a few months ago when the committee was first set up. Wasn't able to get those speakers in. I know there's several departments that was on the list that we wanted to ensure also come in front of this committee. So before we come up with our recommendations, we want want to make sure that we get each speaker in and all departments in so that we can have the full report from this committee that can be eventually brought to the board, as well as maybe even other entities on the state level that can kind of follow some of these recommendations. Before we dive in, if Madam Clerk, if you could just read the resolution. So a very similar resolution that the Board of Aldermen passed last year to set up so that this committee can do the work. Just wanted us to rehear that resolution as we get ready and charged to continue all the awesome work that you all have already started.
Resolution number 13, continuation of the Special Committee on Long-Term Healthcare Facilities. Whereas the Special Committee on Long-Term Healthcare Facilities convened in 2022-2023 session needs additional time to hear testimony and complete its report. And whereas the COVID-19 pandemic has ripped through communities and healthcare facilities, inflicting unimaginable suffering, healthcare providers and frontline workers have struggled to provide the care that St. Louisans desperately need, and whereas nursing home facilities and home care providers have been at the forefront of this need. These healthcare workers have experienced low pay and difficult working conditions for years. The pandemic exacerbated these conditions, exposing fault lines in the system. Inadequate staffing levels have become routine in many facilities, and whereas the majority of the nursing home facilities in the city of St. Louis, which have collective bargaining agreements with labor unions, have better health outcomes for residents who contract COVID-19. Ensuring union access and the right to organize is an essential part of solving the long-term healthcare crisis. And whereas the implementation of workplace safety and health programs is an essential factor in reducing the extent and severity of illnesses. It is widely known that infections are a leading cause of death and complications for nursing home residents and home care recipients. In addition to common infections that have plagued society for decades, the onset of COVID-19 has disproportionately impacted the elderly people with disabilities and nursing homes. And whereas staffing shortages and attrition have further strained nursing homes during the pandemic. In response to challenging working conditions and the high risk of COVID-19 infection, some nurses, certified nursing assistants, and other workers are leaving the sector during this critical time when there is an increased demand for their skills and expertise. And whereas unless infection prevention control in nursing homes is improved, the issue will only get worse. The resident population is increasing as baby boomers age and people are living longer. Now more than ever, it is critical for nursing home workers to be trained on safety protocols and to become vaccinated and boosted. And whereas healthcare worker pay is often below the city recommended level of $15 an hour, the committee should look at ways to help employers reach higher rates of pay or to provide hazard pay. Healthcare workers are often working in unsafe conditions because of inadequate staffing, substandard personal protective equipment, or other factors. It is essential for healthcare workers to be respected, protected, and paid well to do the important work that they do. And now, therefore, be it resolved by the Board of Aldermen of the City of St. Louis that the creation of a special committee be authorized for the purpose of investigating the state of the long-term care field, its nonprofit and for-profit providers, its regulators, its recipients, and their demographic rates of pay, staffing pipeline, systemic problems, and possible solutions. Be it further resolved that no later than March 29th, 2024, the special committee will share its findings and recommendations with the Board of Aldermen. Be it still further resolved that the report will make recommendations regarding safe staffing, equitable pay, advocacy for worker safety and worker safety training. The aforementioned special committee is not limited in size, but may consist of members of the Board of Aldermen, older adults, individuals with cognitive or functional limitations, family caregivers, healthcare workforce members who directly provide long-term services and supports, those who have demonstrated experience in dealing with issues related to long-term services and supports healthcare policy, representatives of the healthcare interests, and individuals from a variety of geographic areas, and demographic groups. The special committee will also seek input from experts in the fields of worker safety as well as experts in long-term care. Introduced this 5th day, May 2023 by the Honorable Rasheen Aldridge.
Thank you, Madam Clerk. I know that was a long resolution. Thank you so much for doing that. Our staff here is so amazing. Before we dive into, again, as we move into this committee discussion, what should be in the draft or the drive that you all got was just a rough draft of potential meetings that we can have moving forward, as well as potential speakers. And when we get to that point, I am very open to any speakers that we may have missed. I know Mr. Howard has sent me potentially 2 other speakers that may need to come in front of this committee. So I want us to be able to go over the draft to get input on that, to see if these dates work out, and then go into the final report outline as well that was sent in the drive. I'll have help with Ms. Laura leading that. But before we move into that, I know this committee has already been going on for a while, but I feel like I'm the new member here. And as people are watching, I also know we have a new Alderwoman, Ms. Sonia, who's going to be one of the Alder people help doing, coming up with the recommendations and doing the work on this committee. So before we dive into the committee discussion, if everyone would, and I'll just call each other, if everyone could just give their name and organization that you work for or organization that you're aligned with, why you want to join on this committee. I'll start. I'm the Alderman of the 14th Ward. Extremely excited to work with everybody to continue the amazing work that I've been watching and heard that has been going on. And I will pass it over to Mr. Andrew.
So, hello, I'm Andrew Lackey, and I'm the Deputy Commissioner for the Office on the Disabled for the City of St. Louis. And so there are many residents of nursing homes. In fact, probably I would say almost all the residents of a nursing home have some form of disability, and so that's why we are very interested in the work of this committee and want to assist it in any way we can. And I will pass it over to Harold Broswell.
Thank you. Hi, everyone. My name is Harold. I'm an associate professor of healthcare ethics at St. Louis University, where I do research on end-of-life care and long-term care. I should also say it's not the reason I'm on this committee, but I'm also a social worker and I'm a psychotherapist, actually. So I'm a mental health provider, and that's become an increasing theme of our meetings, how mental health is linked with long-term care. I would say end-of-life care as well. So that's something I am very interested in as well. I am happy to pass it along to Marjorie.
Harold, I'm Marjorie Moore. I'm the Executive Director of Voice. We are a nonprofit organization that does advocacy for long-term care residents. We're also the contractor that has the Ombudsman program, which goes into long-term care facilities to get to know residents and help them with any of the problems that they may be having within the facility with staff or with their families. And we see it all.
Got a certain person you want to pass it to, Ms. Marjorie?
I'll pass it to Jamie.
Hi, everyone. Jamie Opsel. I'm the Executive Director for the St. Louis City Senior Fund. And my interest is being on this committee is I've worked for close to 40 years in the field of aging. I have a master's in gerontology. I also am the chair of the Missouri Council on Aging. It's a new council that is funded through the Missouri Foundation for Health to help educate state legislators on the needs of older adults. And I'm very interested in this committee because of this, the information that we have learned about these for-profit entities coming in and the deplorable situation that our residents are facing is just awful, and we need to figure out a way to stop this. So I will pass this on to Cassandra Kaufman, my colleague.
I'm Cassandra Kaufman. I'm the Executive Director of the St. Louis Mental Health Board. And much like Jamie Opsel, we are a special taxing district within the city of St. Louis, and we fund adult behavioral health, children's behavioral health, and children's prevention programs. My particular interest is the increasing discussion, as was mentioned, about younger adults with serious mental illness residing in nursing and skilled nursing care, and the opportunities to have them placed in least restrictive environments in the community so that they can be successful. I will pass it on to Lavetta Richardson.
Good evening. My name is Lavetta Richardson. I'm a member of FEIU. I'm also a shop steward with FEIU. I work at Lady King and Mother Center. Over the past 3 years, I've seen a lot that is going on in nursing homes. The pandemic brought out a lot. Other than people passing away from it. Also about these youth owners coming in, trying to do whatever they want to do to the residents of the nursing home, and that's why I'm interested in being on this committee. I can't see anybody.
I think I have Mr. Keith Flint. Kevin.
Good afternoon, everyone. I'm Reverend Kevin D. Anthony, and I'm here serving as a clergy rep or volunteer for SEIU. And the reason I'm particularly interested in this work is because it seems to me that only African Americans and people of color suffer dramatically from these issues, be it poor care or being leveraged by large corporations. So that's my purpose for being here to serve on this committee. I will choose Laura Barrett.
You there, Ms. Laura? See you unmuted. All right. While Ms. Laura try to get her mic and camera working, I will pass it really quickly to, I think that's all the participants. I'll pass it to Alderwoman Sonia, just to give an introduction to who she is and the ward she represents.
Hello, everyone. Thank you, Sir Chair and members of the committee. I am Alderwoman Sonia, and I have the pleasure and the honor of being the Alderwoman of the 7th Ward of the City of St. Louis. I'm super excited to be on this committee. I think some of my sentiments are the same as what Chair Aldrich said in the beginning of this meeting. You know, I've been following the work that you all have been doing on this committee, and even though I haven't been a part of the legislative end of it, since I just joined the board, I have been to many rallies, and many things that I've done and have been a part of the conversation. So I'm just excited to be a part of this committee. I think it's important to, I know that people have wins, but I think it's important that we keep our eyes on the ball, and I'm sure there is much work to do. And I think just having a committee that is, regularly active shows that this is a priority of the city of St. Louis. And we know that many of our residents, whether it's disabilities, whether it's mental health challenges, whether it's, aging, whatever the case may be, there's a segment of our population that is reliant upon services that they receive in care facilities, and therefore are vulnerable and are reliant upon advocates and leaders of all sorts to be active and make sure that we're letting people know who run these entities and sometimes put the interest of profit over people, that we expect for our people to be taken care of and to get the quality of treatment that they deserve. In a past life, I was a mental health advocate. So I say in a past life, but before I was elected as Alderwoman, I was a mental health advocate and served on the Board of Education. So I'm extremely passionate and happy about these things, and am honored to get to play a role in this process and in the committee.
Thank you, Alder Lady. And you all know, unless Christina Gracia want to say anything, you guys know Christina Gracia amazing Alderwoman, now Director of Operations for the President Office. Like I say, she'll be helping us ensure that we get everyone potentially there needed. And I think I actually forgot one person, Mr. Howard. Did I forget you? Mr. Harold, I'm sorry about that.
No.
Did Mr. Chris Bakley speak?
Yeah, hi. So I'm Chris Beckley. I'm the CEO at Cardinal Ritter Senior Services. We have a full continuum of care. We have a nursing home, Mary Queen and Mother Center. So I've been in long-term care either as a clinician, as a physical therapist, or administration in long-term care. I also serve on the board of Leading Age, which represents all the nonprofit providers in the state of Missouri. And really my interest is from the lens of the provider who's trying to hire good staff and provide good care.
Awesome. I didn't forget anybody this time. Everyone spoke. I know Laura is potentially trying to work on her sound and camera. Anytime you get that going, Laura, just jump right on. So going to the committee discussion. Did everyone get the email with a draft of kind of the plans of future meetings moving forward and also the final report outline? Just by a thumbs up if y'all got it, or head shake. Okay. So at the beginning, talking about like the plan for the long-term healthcare committee moving forward. So the goal ideally would be great. I see one hand up. Mr. Kevin, did you want to say something?
No, that was confirmation on the email.
Okay, awesome. The goal ideally would be great. So the Board of Aldermen is going down on summer break this Thursday. Is our last meeting before summer break. Supposed to have been last Friday, but we have a special meeting coming up this Thursday. And it would be great. The board don't go back into September. I know this committee has already done a lot of work. And like I said, I know a few things that we need to do is just fill in some holes with having a few more people speak. But it would be great before the board come back in September, if we can have all our people that did not speak last meeting speak coming from the committee, and then us kind of start to work on the recommendations. So as the board go back into session in September, we can deliver these recommendations to them. And then it would be also a really good time before, as me and Laura talked about before, our state reps and senators go back into session in January, if there's any state recommendations. But there's several meetings planned out. Ideally thought that Mondays would be good. And if 3 p.m. works out with everyone, want to make sure I keep it consistent. In that draft, we wanted to lay out a few speakers that didn't speak. So the health department was one of the people I heard that still need to come in front of the committee. Lenny Jones, the building division, Theo from Hillside, Ms. Marjorie from Voices, Sam from the National Consumer Voices, and Mr. Howard, I think you had a guess. Is there any other entities that I'm missing or folks that we need to add to potentially the speakers list? And it seems like last meeting, it was 2 speakers per meeting, depending on how much information they can put into one. If we need to get to 3 speakers, if that works with the committee, I'm willing to adjust to that as well.
I believe that I might be able to get the family council president from recently changed hands from a nonprofit to for-profit to come and speak just on the changes that the families of residents are experiencing, if that's something of interest.
Okay.
One of the things we had discussed before and make a decision on, I think there was possibly some interest from one of the for-profit owners into maybe not coming to publicly testify, but answer questions. So if I can help with that, let me know if there's an interest in part of the group and having them weigh in on some of these concerns.
Yeah, I think that can you guys hear me now? Hi. Great. Yeah, I think that one of the owners of Luxor that we had reached out to, and they did say they were willing to go ahead and submit stuff in writing. So that would be great. Apologize for the technical difficulties. I have no idea what's going on.
Thanks for joining us, Laura. We were just going over the plan, the draft of kind of how we can move forward, and if we are missing anybody that potentially have gotten missed from last meeting.
Yeah, if I was going to weigh in, I would just say really hearing from the health department, the building division, I think is really important. Sam Brooks was actually quoted from National Consumer Voice, was quoted in the Post-Dispatch this week as an expert. So I think it'd be really cool to bring him in if possible. But I think we've actually heard a lot of testimony from a lot of really, and we have a lot to think on. So I feel like we've really actually gotten a lot of input. I'm sorry that Alderman Aldridge and Saunier were not here for some of that, but the YouTubes are great to review, and there's quite a bit in there. But yeah, it feels like we've got a lot of input from a lot of folks. And by the way, I have a couple of the members of SEIU with me today. So we've got a couple of folks here: Amy Jones, Shonda Whitfield, Dewana Dunning, and Lenny are sitting in with me. So we've got a full house here. So just so you know who those extra folks are. I think that's all.
Always good when there's members around, the ones that are, I say, in the trenches doing the work, and so appreciative of all the work that they do. So I got that input from you, Miss Marjorie, and also potentially the for-profit from Miss Christina and also Laura. So we'll work to see if we can add those. If potentially adding 2 more speakers just from the rough draft, we would meet, we could try to squeeze in those speakers where we have 3 speakers per meeting. That would get us to a ideal goal of getting done by the 14th, where we can start to review everything and start to come up with the recommendations. That may take a few more weeks, which would put us kind of right on track before the September meeting. Do the next following Mondays, 7/24, 7/31, and 8/7 work with everybody at 3 p.m.? Okay, I'm assuming everyone got thumbs up. If you don't, just put in the chat to say it doesn't work with you. And then are we okay with the speakers that are on the list, potentially bringing in the health department, Lenny, buildings division, Theo from Hillside, Ms. Marjorie of Voices, Sam Brooks, Mr. Howard had a guest, family changes, and it seems like for profit. Do all those individuals that probably haven't been heard from last year make sense to bring them in front of us for this year?
Yeah, if I could just say a word about the person I wanted to bring in. He's somebody that I had talked about in our previous iteration. I'll put a link. His name is David Barton Smith. He's a professor emeritus at Drexel. He wrote this article that I just posted in Health Affairs, Separate Unequal Racial Segregation and Disparities in Quality Across U.S. Nursing Homes. So he's an expert, maybe like among the experts in racial segregation in nursing homes, doing back, decades of research. And he actually has a presentation ready that we just didn't have time to do. So I appreciate it because it looks like you did it. And I also think it would add a lot to this. Do that. I had thought about another person. I wrote you, Alderman Aldridge, about another person, but I don't think we have time to do it, but I will read their book and put it here. I'm putting it here. It's this guy, Brendan Ballou. He wrote an op-ed in the New York Times. He wrote a book about private equity. And, so part of the story about private equity is the story of nursing homes in America. It's not just that like nursing homes are very central. I don't know if any of you guys have watched Succession. There's actually a plot line in Succession where one of the characters is like a private equity person involved in nursing homes. I recommend it. But this is a big part of the story. And so it would be good to have some ideas about, we do have some ideas already, but to get more ideas, but maybe I'll just read the book and I could shoot him an email just to ask if he has any thoughts about what we might do if we don't have time to invite him in.
Yeah, and depending on after we hear everybody and we start to go into the findings and review of the whole recommendation, if we got time to fit it in right before the September meeting, I'm definitely willing, if it works everybody's schedule, to be able to fit it in, to be able to still hear his remarks and make sure that it's out there for viewers all across St. Louis so that we can either add that or so that information's out there for our region to be aware of. So I want to start locking down these speakers. On each date, we have roughly about 2 speakers speaking. I think on 8/7, we'll try to have a 3 speaker speaking, but with the lineup, is everyone okay with my next meeting trying to have the health department? And since I think Lenny walked in the room, would that work for SEIU and the health department to come in front of us next week? Would that work for you, Laura?
Yep, that sounds great.
Okay. So I had Miss Moore. I know you were scheduled for the 8/7, just a rough idea, but if you wanted to go sooner, because I knew that you needed to go last year, you're a member of the committee, I potentially could have switched you in the building division. It's totally up to you, but either looking at next week having the building division and then Theo from Hillside, or if you want to go first, Miss Moore, I can try to switch the building division and yourself.
I would say get the building division, whichever day they can go. I'll be at all of them. So just
Okay.
let me know which works.
Okay, so I'll just aim to get because I think the building division and health department, especially from the city standpoint, would be good to be able to answer some of these questions. So we'll stick with reaching out to the building division for the following meeting on 7/31, and then Mr. Theo from Hillside for 7/31 meeting also to speak. And then on 8/7, I have you, Ms. Moore, Mr. Brooks, and then Mr. Howard, your guest, Mr. Davis. And then I will work with Laura and Director of Operations and Gracia for the potential 2 people to see if either we can squeeze them in on the 24th meeting, the 31st, or if we may need to just sneak another one in if it's worth being part of the findings of the report. Does that schedule work with everybody? Okay, I'm seeing head nods, so I'll take that. So next, I wanted to just move into kind of the final layout, and this is all a rough draft. So please, as we get closer to the layout, this is just want to have a draft in front so we can kind of get our brains thinking of how we want to set up the recommendations. But this is our committee, so if anything need to get changed, we can set up whatever these recommendations look like. But I'm gonna have Miss Laura from SEIU just talk about kind of what the final report can look like as we get into the last few weeks of trying to create this final recommendation to bring to the Board of Aldermen.
Okay, thank you so much, Aldridge. So looking at the final report, just want to make sure it's something that is readable and something that folks are able to take, glean from the report, all of the important information we've gathered in this committee. So it's just starting with an executive summary, then going into an introduction, having a couple of worker and resident profiles, that just makes it more real for people if they can hear real people's voices. So like maybe 1 or 2 worker and resident voices, having both of those. And then we go into our findings. Really, what did this committee actually discover while we were meeting? And I would remind folks, we think we're the only municipal committee like this in the country that is taking this on. So it's really important. So we want to make sure we really organize our thoughts really well. So looking at the problems, I think the things that we've identified up till now are the city of St. Louis is just like a predictive trend setter. So we're kind of ahead of the rest of Missouri in terms of these terrible trends that we've noticed, but the rest of Missouri is also kind of coming with us on a trend. And that's, the out-of-state owners with Luxembourg, Riverview, very quickly acquiring homes and creating a lot of chaos and then nursing homes. The lack of staffing standards and the fact that there's low pay and staffing shortages are really hurting residents and workers. And the state is also, as we learned from the important testimony of Tracy Niekamp, the state is really failing to inspect those homes in a timely fashion, and that's really worsening all of these problems. And then the one that's up over and over again from a variety of folks is that there's been an increase in of nursing homes as psychiatric facilities. So several nursing, including Hillside, Berea of Cahokia, which is in the Metro East, but is still in our area, and then also Estates of Spanish Lake are all completely psychiatric facilities at this point, even though they used to be skilled nursing facilities, and that use is increasing. Actually, SEIU just met with Steve Boland from the state on Friday, and he confirmed that is continuing to happen. So we want to talk about that, and then also the fact that the state is being investigated by the Department of Justice, the Civil Rights Division, because of this, because they believe that folks are being unduly confined by being in nursing homes rather than being in the community. As we heard from Places for People, it is possible to keep folks in the community and is really preferable in a bunch of ways, but we need to really fully fund facilities like Places for People. So that's sort of the problems that I had outlined there. And then the policy solutions would include kind of like the Ferguson Commission, like we'd have levels of different policy solutions for different governmental bodies. So the city of St. Louis and other Missouri counties, because you know we're a city and a county, would this is a couple of things I just lined out here. I'm sure we'll come up with a few more, but more frequent and prioritized inspections and fines by the building division and the health department seem like a really important recommendation. There's only 16 nursing homes in the city of St. Louis. It seems like thinking about what are those 16 homes that are there and how can we really start to turn things around. One thing that's just really important is making sure that the buildings are physically maintained. As we heard, Hillside has got, major physical problems with mold, holes in the wall, bed bugs, other pests. So the building division could really weigh in there. And then also just the health department weighing in on what residents are actually eating, and then also the incursions of insects. The other recommendation we can make is around a worker safety officer, having somebody who actually is responsible to hear from the workers in the city and actually get their input, write a yearly report, and start to actually organize some of the input that they're getting from workers from all over the city. And that could also include helping workers to get reports to OSHA and to other governmental bodies. And then just also financial support of worker training and workforce development options seems like an important way that we could also further support solutions here. On the state level, it's more frequent inspections and fines, perhaps doing a blue ribbon commission that would be a little bit similar to what we're doing here. They've got really important issues that the state is in control of because Medicare and Medicaid are for carrying out the nursing home care, the skilled nursing care that takes place in the state of Missouri. They're actually basically commissioned by the federal government to do that work. So like thinking through what their role is through a blue ribbon commission could be really helpful. And then also just revisiting the standards of nursing home certificates of needs could be another way the state could take a look at this. Do we actually have too many beds? Should some facilities be strictly psychiatric facilities and others are just strictly skilled nursing facilities? How are we separating this? Taking a look at all of that are things the state could take a look at. And then on the federal level, fortunately, President Biden is already taking action on this, and we're really excited about President Biden's staffing standards that are going to be proposed shortly, and then also his rules around financial transparency. Both of these things we've just identified as being huge sources of the problem. We need more trained workers who are, making this a livelihood, a way of life, a path for them throughout their life. And so like increasing the ways that they are setting on that career path is really important. And then also just bolstering up training that's available for folks. And then taking a look at how are these private equity folks getting into the market in the first place, and what kind of money are they making off nursing homes in general? we heard a lot from the professor at Cornell as well as others in this committee, which was just incredibly great information that Professor Braswell arranged. That those pieces are being addressed by President Biden at the national level, and that could be part of our recommendation. So those are the kinds of things I sketched out. I know we're going to try to do a much fuller report, but thought this could at least give us a little bit of a direction. And I'll turn it back over to you, Alderman Aldrich.
Thank you so much, Ms. Laura, and thank you for putting that together. I know when me and you talked on the phone last week, I really liked the idea, former member of the Ferguson Commission, so I could be a little biased, but I really like the idea of how I think you all have found, like you said, a lot of problems that are locally, and with this being kind of the first committee in the region to be looking at the challenges after COVID or post-COVID in our long-term healthcare facilities. How do we also help like other areas as well? While we are, our task is to focus on St. Louis. You know, if you drive in some of these wards and you go a little farther west, you're right in the county. And I'm sure a lot of these long-term facilities, not just in the city, but also in the county, dealing with these same issues. And I love how you tied in city, regional, state, especially as some of our state reps will be going back in January, and then federal. And I know that Danielle Spradley, who sits on this committee, who works for the Congresswoman, it's good to be also lifting up what we can be doing on the federal level. So I like the layout, but I want to open it over to the committee just for any comments, input, or other comments on the direction potentially headed for the recommendation element.
This is Andrew Lackey. Laura, when you were talking about the DOJ, it sounded like you're talking about a potential DOJ investigation into the state with regard to an Olmstead violation. I think this committee, I think when it was originally formed, there was talk about that it was going to focus on really the how to make you know, the nursing home structures and systems sort of better, and not really kind of focus on community long-term diversion, or helping make sure that people can transition into the community. That was sort of initially. Do we want to broaden I mean, it sounds like that would be a potential opportunity to sort of lead to that or broaden that scope. I mean, what are the thoughts on that?
I think you bring up an excellent point, Andrew, and we don't know exactly what the Department of Civil Rights is coming up with in terms of their investigation yet, because they haven't released their findings. They started that investigation last November, but we don't have that yet. What we do know is that Missouri is putting far more folks into nursing homes, and then more folks with psychiatric diagnoses than other states, and especially in the city of St. Louis. So just from the quick look that briefing paper did that we submitted when the committee just started, at how folks in nursing have a on the state level, and then how many folks on the city level in the city nursing homes had the psychiatric diagnosis, and it was like 40% of the folks in the city. And as Marjorie brought up earlier, that can be a problem as well. It could be that folks are being overdiagnosed, and we spent some time in the committee teasing that out a little bit and thinking about our folks being over-medicated as a way of controlling their behavior in nursing homes. So like that's another piece of this that I think is important to bring out. But yeah, the sort of the reason I put that in there was a little bit of a placeholder, Andrew, and I think you're bringing up a really important point that we really need to kind of broaden it out from just that investigation and take a look at all of the different angles that the committee really teased out about this during those initial meetings that we had.
I think the other piece to that too is the guardianship system, because that seems to be where a lot of the people with mental health issues, how they ending up in the nursing home is they are assigned a public guardian who then places them in a nursing home as kind of a default sometimes. And once you're in there, it's extremely hard to get out. So I think that kind of teasing that out as part of it too is important. And especially since the public administrator for the guardianship system is a employee of the city.
This is Chris. I think I appreciate Laura's summary. I think a couple of things we're missing though is encouraged to hear the workforce education piece, but there's also an issue of workforce availability, competing with just the sheer number of people available. And then also I didn't hear anything about reimbursement, and most of the folks that are in the nursing homes in the city are under Medicaid, and there's a pretty big gap between the amount of reimbursement we get from the state and the cost to provide that care. A lot of the for-profits are able to make some of that reimbursement because they control a lot of the ancillary services like lab, therapy, x-ray, all those type things. So I think we'd be remiss not to talk about the workforce challenges in general and also the reimbursement models.
Right, and also the difference between for-profits and how they're charging stuff and nonprofits. So I think we did talk a little bit about that in the committee. I think you're bringing up a really important point, Chris.
I think also Missouri nursing homes and certainly our area in particular are going to be really challenged when the president puts out the staffing guidelines. Missouri is now officially the lowest providing state in the nation as far as hours per resident per day of care, a full hour a day less than what I would expect the recommendation is going to come out to be. It's hard telling what that's going to be, but we're going to need a lot more workers to meet those standards. I don't know what the repercussions of not meeting those standards are going to be, from federal standard, but I think we know what the repercussions are in our nursing homes right now. So I think we already see that. So yeah, Chris, I agree. There probably has to be some talk of, getting nursing homes some more money somehow, but making sure that goes to direct care.
Yeah, and we would love for that direct care to be by our own folks. The other thing we run into, obviously, with the shortage is running contract labor. And then the more contract labor you're bringing in, the higher that percentage goes up. It's directly correlated to your quality. So it's a vicious cycle, and it's truly availability. There's just competing with, other service care workers and try to keep pace, but there's just not the bodies out there, and we're competing for the same people.
All right. Any other members want to throw in their 2 cents on potential things that could be in the final report outline?
Just had a question. Laura, can you say what you said again? What did you name you named the position that would be in the building division that would go and do the inspections? And did you have a recommendation on how often you think the inspection should be?
Oh, yeah. Thank you for bringing that up, Alderman Saunier. So there's kind of two pieces. One is the inspections by the building division and the health departments and how frequent those should be, and then also increasing the fines for folks who are for owners who are non-compliant. So that's like one piece that seems like it could be addressed through legislation or through some kind of resolution or departmental policies. I think probably legislation is the cleanest way to do it. But then there's also the idea of having a worker safety officer that would be available for all essential workers, and that would probably take legislation, and that person could then be housed in the Civil Rights Division at the city. And that would be a person that would be available to workers to basically create an annual report. Because right now, some of the issues that we're talking about that we know about are issues that aren't known to the general public, right? About the shortage of workers, about what workers are going through, about the safety issues, about infection the infection rates, and the fact that workers have gotten COVID, 3 and 4 times. All kinds of those kinds of things are not being lifted up because we don't really have a systematic way of gathering information about workers in the city. So this worker safety officer, that would be their job, and it would also be their job to assist people with getting to the appropriate authorities like OSHA and others so that we can actually start to get some enforcement of worker safety standards. And so that's the thought, is that a position could be created within the Department of Civil Rights to assist with all of that. And we did talk with President Green about that, President of the Board of Aldermen, Megan Green, and she was interested in working with us around that. And I think love to work with you all in terms of how that could be further developed.
Do you know what are the current fines in place? Do you know that? It's okay if not, I'm just curious.
I'm sorry, I missed that.
Do you know the current fines in place? What, like, do you have an idea of what fines are that are in place?
I think we need to do a little more research on that. So yeah, definitely.
Thank you.
They're
And I
not
know they'll be coming in front of us on 7/31. So that'd be a good question, because I know they have different level of fines that they do for us, vacant buildings, condemn, and all that. So good question, Alderwoman. Any other questions from members on the committee on the final report outline? Also, just want to give an opportunity. I see Alderwoman Clark Hubbard is on. Did you have any comment or questions at all, Madam Alderwoman?
No, thank you. I'm just listening in.
Thank you so much. All right. Well, I will make some edits also with Laura, make some edits. So this is a working document. We have, like I say, several other meetings before we get to the actual start putting things in place for the final report. So at any moment, if we end up missing something, or you think something need to be added to the final report, or anybody that need to come in front of us over the next few weeks, please always shoot me an email saying, this is why they should be coming in front. And as a group, we can figure out what will work best for everyone's schedule to bring them back in front of us. If no more comments on the draft of the kind of next few meetings and the people that's going to be coming in front of us, and on the final report layout, I would move that we go to announcements. Be respectful of everybody's time. Anybody have any announcements? I don't have an announcement, but I just want to make a comment. Again, I am really excited to be on this committee, chairing it, also with the support of Vice Chair Pam Boyd and Alderwoman Sonier, as well as Christian Ingrassi, who's the Director of Operations. I know you guys have already put a lot of hard work into having people come in front of this committee, coming up with the challenges that we're facing post-COVID, and ways that we can either pass solutions through legislation locally, through the state level, or on the federal level. So I'm excited. I know it'll probably only be a few meetings, but ready to get to work on behalf of this committee and work with you all to get to the point where we can come up with a pretty amazing recommendation that can be used, not just in St. Louis area, potentially even regionally, understanding that a lot of our issues that we face are regional issues. What happens in St. Louis affects St. Louis County, as well as state and federal. So really looking forward to working with everybody to continue the amazing work that you all have already set up. Any other announcements outside of myself? If not, Madam Clerk, I would like to excuse Alderwoman Pam Boyd from today's meeting.
Are we going to excuse any of the other?
Yes, and any other participants that.
So that's Pam Boyd, Danielle Spradley, Cindy Jackson, Kathleen Holmes, and Annalise Stover.
I'd like to excuse those members from today's meeting. And then next, I would like to make a motion that we adjourn to 7:24 at 3 p.m. via Zoom. Do I have a motion for that?
So move.
Second,
All in favor, say aye.
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 Any
Aye.
opposition?
Aye.
All right, meeting adjourned. Thank you guys so much.